Hi Louise, how are you?
Hello, Hans.
First and foremost, if you could tell a little bit about yourself, Louise. How did the COVID-19 pandemic impact you, right, as a professional and as a mum?
I'm 33 years old and I'm a nurse in a paediatrics unit, pediatric emergency room. During this pandemic, the general practitioner are closed. So we are taking care of all children with cough or fever or sore throats or anything that might be COVID-19 related. So we have been busy taking care of everybody. Furthermore, my husband at home, he is a nurse as well in the ER for adults. So
Wow.
yeah, so we've been quite busy.
I was wondering, both as a mum and as a professional, how do you see this with your daughter?
Definitely my daughter, she is suffering. She's missing her friends and school and teachers and everybody. But she's the daughter of a nurse. So I will tell her she have to do this because
Yes.
it's an unusual situation. And hopefully the vaccine status will get it better soon, but she's just hanging in there. I think it's the most difficult that right now as a nurse, I homeschool her in daytime and then in the evening I go to work. So the time she has with me as her mom is not even there because at daytime she's in school and in evening time I'm at work.
And if I'm correct, you're a nurse who already got the vaccine, right?
Yes, I got the vaccine three
Okay.
weeks ago. My husband as well. Yes, at the same time. And I was so relieved that day.
Great news. I mean, and makes me very happy because that's what WHO always advocates, the healthcare workers first and then the elderly people. What would be your message to the people in Europe on getting the vaccine? Because as we know, in a number of countries, we have to work hard to decrease the vaccine hesitancy. And of course, I understand, particularly in those countries which has not started yet the vaccination, people have questions. Is it safe? How is it possible that the vaccine was developed so fast? So when you got the first jab, did you feel something or you didn't feel anything physically, right? And what would be your message to the healthcare workers and to the people in Europe?
When I first got the vaccine, I was feeling relieved because I think it was a big step forward. And some side effect I was experiencing was I was a little bit tired afterwards, but it was only for like 12 hours. Then I'm feeling fine again. My husband as well, feeling great. Nothing, a little sore arm, but but nothing else. I think it's quite important in this pandemic that we're getting vaccinated, and especially as a health worker, because in my facility there was recently a major outbreak during the staff. Um, yeah, so for me it was like important to be a role model as a nurse, to go first. um, Nursing is a trusting profession. I see myself has a unique position in be a role model. I don't be afraid. I didn't be afraid of the vaccine. I think it's the way to step forward to end this pandemic. um, and I also want to take care of my patients, my colleagues, my family, and myself. So I have been afraid for the last 11 months to take the infection with me home. So this vaccine was a big step forward, and I feel like relieved. Yeah.
My colleagues told that the best advocates for nursing and midwifery are the sons and the daughters of a nurse. So my mum is a nurse herself, was working in the surgical theater. So all my appreciation really. And I'm just wondering, Louise, whether you have any questions for me or any advice that you say as the regional director of the World Health Organization for the 53 member states. Is there something that you would like WHO to do more or to do better or to pass a message?
I was just wondering, actually, when I'm sitting here in front of you, to hear how do you see this pandemic? In which way do you see it will go? Because I feel like more than ever now, actually, between my colleagues, they're all tired. Everybody's just tired, and feel like they are compromising now with the children. And where do you see this pandemic go? Does it ever have an end? Or
I'm optimistic, Louise. First, because I try to be an optimist by nature, but also factual, based on facts. So 2021, in my view, will be another year of COVID, another COVID-19 year, but it will be more manageable. It will be more predictable. We have to hang on for another 6 to 9 months, but it doesn't mean it will be 9 months the same as now. I think that society will start to open up gradually. The biggest threat, I think, is that people think they can lower their guard and are not vigilant anymore because of the vaccine. But as we know, it will take a bit of time before a majority of the population will be vaccinated. But some functions, some very important functions in society will return to normal. I always like to refer to an own experience. For my parents, who are living in Belgium, it has been more than a year that they could see and hug my 2 daughters. And this is a very important societal function. So even if it is not perfectly the same like before the COVID-19, to be able to do this, I mean, I think they don't want anything else. So in that sense, I think it's very hopeful. And it's not only the vaccines, also the treatments. We are getting more smart on treating more severe patients. But I'm very hopeful that we will have the upper hand soon. And I think it's this message that we have to give to your daughter, my daughters, that there is what I call light at the end of the tunnel. It's very uncertain times, and the only way out, I think, is to stand together in solidarity. I want to thank you very much, Louise, for first and foremost for the so important work that you're doing, and we'll be in touch. Thank you so much.
Thank you so much.
Thank you. Hi.